Okay, hello everyone, and thank you so much for the introduction, Krista, and also thank you so much for welcoming me today. It's definitely an honor to be presenting to you all. It's always funny to know that there's apparently 74 people out there. I can't see, but they're in the ether. So hello to each and every one of you. So let me just pull up my slides, and we shall jump right in. Okay, so today I'm going to be talking about AI and its kind of use case in mental health care, and kind of more so also how it's going to be adopted in healthcare and what I think the kind of really exciting parts of artificial intelligence is going to be. And I will thank you already for doing the land and acknowledgements. So just to really again acknowledge that piece, and I really hope that there are going to be applications of AI to help really dismantle the colonial barriers of our healthcare system and make our healthcare more equitable. Just a quick disclosure that some of my fellowship funding when I was doing my fellowship did come from Pfizer Canada. I won't be talking about any Pfizer products today. And I also actually very recently just started some collaborations with Amazon Canada. And again, we won't be talking about any specific Amazon products or anything like that today. But of course, I do have this intellectual bias that I am quite interested in artificial intelligence. I think there is a lot of hype out there, and really one of the objectives today is going to be giving an idea of actually what is AI. There's so much talk about these days about is AI good, is AI bad. I really want to introduce a little bit about what artificial intelligence actually is, and then talk about some projects we've been going on and some potential ways that AI can be used really to help our patients, help ourselves, help clinicians, and so on. And we also are going to have a little bit of a surprise at the end, a chance to actually try a new AI tool that we're developing, which I think is going to be hopefully going to go well, and you'll find it pretty interesting. Okay, so I think in Zoom sometimes you could do like the hands up or raise hand or whatever thing. But I always like to kind of start by just asking folks, have you ever been a little spooked by how well something like ChatGPT works? And I, before this, I would actually ask about, have you been a little spooked by how well ads are targeted on the internet? Because even before ChatGPT, there was actually a lot of AI everywhere. An example I like to talk about is I was once in Gmail and it was recommending me this Mila cordless vacuum. And you might think, well, that's kind of a weird recommendation. But this was right after I had moved, and so I really needed a vacuum. My place was a complete mess. So, it was interesting that Google is using artificial intelligence techniques to be able to really target these ads to me, right? And generally, if I had to kind of explain what my research program is at UBC and BC Cancer, it's this realization that the big tech companies are developing and have developed these really great tools to do things like sell us vacuums or whatever else. But instead, can we start to use these technologies to actually help our patients, help clinicians, help caregivers? I think there's a lot of potential to really use these technologies for good. And when people ask, well, is AI good or bad? I say, well, it's like any tool. Any tool could be good or used for good or used for bad. And I think there's a lot of potential good that really could come. So let's kind of start by really talking about what is artificial intelligence, right? And the definition I like is allowing a machine to perform a task without explicit instructions. So what do I mean by that? If you are already kind of bored by this talk, fair enough. You pull up your app and you double click on your favorite app to spend some time. A programmer has programmed it so that if the finger tap is detected, it would be a statement something like if finger tap equals true and position equals this and this, then open app, right? So these are explicit instructions that we've really told the computer exactly how to act. And most of the interactions we have with a computer are kind of like that. Like if you move your mouse around, we told it how to move around, so on and so forth. Okay? Artificial intelligence allows computers instead to do tasks without being told exactly how to do them. So the explanation or the example I like to give is actually one of the first real world examples of AI being used. And you might think, oh, it must have been like 2 years ago, 3 years ago. No, this is actually from the 1980s. So here on the right, you can see a bunch of digits. And the USPS, the United States Postal Service, they have 5-digit zip codes, 90210, right? So they wanted to recognize handwritten digits and have a computer, machine, etc., send the mail to the correct zip code or sorting or however you sort mail. I have no clue, but something like that, right? So you can't really tell a computer what a handwritten zero is. You could say, okay, computer, a zero is a circle, but then the problem is that sometimes people write circles that aren't zeros, right? You can see this one here. I don't know if you can see my mouse. No, probably not. But you can see some of them are circle, or like an 8, for example, that's 2 circle. Well, not really, because some of them aren't connected, right? So when we want to instead figure out a way to tell a computer, can you kind of learn what a zero is? That's what we call artificial intelligence. And you can think of other examples like a self-driving car. You can't tell a car exactly what to do in every possible situation when it's trying to drive itself. You need it to be able to learn and kind of adapt to its environment, and that's another example of AI. You may have heard about what's called generative AI. Generative AI is applications when we want to make something new, and I'll give some examples of that in a little bit. And then we also have general AI, or artificial general intelligence. And the idea of that is that you want to do many tasks at the same time, right? The only thing that really separates our current AI systems and an AI system in something like Star Wars with the, C-3PO walking around or whatever your favorite sci-fi is that our artificial intelligence systems tend to only do one task at a time, right? The car either drives, or Alexa will talk to you, or your email will suggest words to you. But if you could wrap those all together, then you kind of start approaching what's called artificial general intelligence and the robots in Star Wars. But in a sense, we're not that far off from it. The problem is the more tasks with AI you do, the more chance there is for error. And if one part messes up, then the next is going to. So, a lot of our systems just aren't really good enough so that we can't really have androids just yet, for example, but hopefully soon. So I've now kind of said, well, AI is getting computers to do things without telling them exactly how to do it. You may then wonder, well, how do you actually do that? How do you get the computer to teach itself so that it could learn tasks? And we do that via what's called machine learning. And machine learning at its core is a really simple premise. The idea is you really just give the machine training data. So you can see here that 4, it's kind of a weird looking 4, but pretty, most humans would recognize that as a 4 if we wanted to. And you tell the computer, hey, that's a 4. And then you give it that little 5 again, most people would recognize it's a 5. And then you tell it, hey, that's a 5. And when you do this over and over and over again, using a bit of math, the computer will then be able to teach itself what these numbers are. And this is very similar to like how humans learn, right? For instance, becoming a doctor, when we're in medical school, we'll see a patient, we'll not really know what their diagnosis is or what to do with them, how to help them. And then our staff physician, our mentor, will tell us, oh, that's pneumonia. You want to use this antibiotic. And then we'll go to the next patient. And we'll also be confused. And then they'll tell us, do the next one. And if you're me, you'll go to the next patient, you'll still be confused. And then your mentor will tell you how to help that one. So that's kind of how computers work. You need to give it lots and lots of data that have labels, and then it's able to teach itself, okay, if I'm a car and I see this in front of me, I should do this. Or if this is a squiggly line, that's actually a 1, for example. Okay. Now, you might have also heard about the term natural language processing. So NLP, as it's often called, is AI when we're using it with language. And that's become really popular in the last couple of years. I'll talk a little bit more about the history of AI a little bit later, but NLP is really becoming really popular thanks to things like ChatGPT. And so you might hear this term. I think it's a useful one to know. It's kind of funny also. That's why I like talking about it. So we call it natural language processing. And you might wonder, well, why do you call it natural language if it's just like processing language data? And the reason is because computer scientists, If you say language processing, they'll think you mean like Python, Java, the computer programming languages. So if you say natural language, that means something like English, French, Mandarin, etc. So NLP is when we apply AI uh, to human language, text, that sort of thing. And essentially how it works is you have different ways of turning words into numbers, because computers can only use numbers, and then you use your standard machine learning techniques. Okay? So I'm just going to go over a little bit about what these actually do. And then the next 5 slides are like kind of the only really kind of more technical sort of slides in the presentation today. The purpose of them is to give you an idea about what actually is all this AI stuff, and like how does it actually work under the hood, because it's actually not that fancy, and I really want to get that across. Like, we can do really cool things with AI, but at the end of the day, it's actually just using kind of simple math that we're just doing a lot of, set up in a way, and that actually lets us do really interesting things. So I'll show kind of mostly this one example of how NLP works with one of the traditional methods. This is a non-neural method, but that just means one of the older ones. And if you were using email, let's say 20, 25 years ago, probably it was using a system like this. So the idea of the bag of words model, so model means like the way you design the AI's brain, is that you simply get a list of words, like 100, 1,000. You count how many times those words are in a document, and then you just put that into a standard machine learning algorithm, because now you have numbers. So I'll show you an example here. So let's say that these were 2 cancer patients, okay? And this is from the document that the cancer doctor writes after seeing the patient. You could read these 2 and see which you would guess would be more likely to see a psychiatrist, right? Because one of my projects will talk about it is figuring out which cancer patients need to see a psychiatrist using AI. So if you read the first one, Mr. Oski, he's worried about his recent diagnosis. He thinks his husband may leave him. You probably think, oh, that's somebody who might need to see a counselor or see a psychiatrist. I mean, you don't know for sure, but maybe. Versus Mr. College, he hasn't been too worried about his recent diagnosis, and he's about to leave to Cancun. So this person's mental health probably is doing pretty well despite having a cancer diagnosis. Kind of unlikely, but so sometimes people are like that, sure. And so essentially what you can do is you could have these words as your list. So you could count how many times worried comes up, diagnosis, leave, stress, things like that. And then you can make an algorithm that kind of looks like this. And this is just the probabilities of seeing a psychiatrist. So for example, if you have the word worried in a document, the patient is very worried, you might increase the probability of seeing a psychiatrist by 40%. And then if you see the word leave, that's worth, what did I put here? X2 is 25%. Okay? So this is how you would have a very simple NLP algorithm. You would count how many times you see these words, and then you would add up those percentages. Okay? And most of our fancy AI is really essentially just something like this, but a little bit fancier. And I made this example specifically because you could tell that it's going to have problems. Because actually, worried is, let's say that's something that increases the chance of needing to see a psychiatrist. But you could see that in the second sentence, it was hasn't been too worried. So that's kind of a negative. So it would actually kind of trip up an algorithm. And that's why we have fancier techniques. So again, just like a few more slides, and then we're kind of going to talk about kind of some more general stuff. But you might have also heard about the term neural networks or deep learning. And that's essentially what most AI that you're going to hear or interact with is based on. It is kind of designed to be similar to a brain, which is kind of interesting. But again, it's actually very, very, very simple. Essentially, what these circles represent is just a yes or no. And what the lines mean is that you have a bunch of yes or no's that could influence other yes or no's. And by having these networks, we could then do fancier predictions and fancier analysis. And the interesting thing is this is actually very similar to how our brain works. In our brain, we have neurons, we have nerve cells, and they connect to other nerves, and it's either 1 or 0. The nerve could turn on or turn off. So especially being a psychiatrist that treats mental illness but also does AI, it's kind of interesting to think about the possible connection between our biologic neural networks that are inside the brain and the artificial neural networks that are being run by our computers. So again, this is just an idea to kind of explain how AI kind of understands text. So one of the newer techniques is called convolutional neural networks. And what that does is it allows the AI to read multiple words at a time. So this is nice because you can understand that hasn't been too worried has a very different meaning than has been worried. Those could be different convolutions, and the AI can learn that instead of only understanding what worried means, it can understand that has been worried, hasn't been too worried, are two very different concepts. Similarly, there's something called recurrent neural networks, and how that works is the AI reads a word in a document one at a time, but then remembers what it's read in the past. So it might come across worried, think, oh, if I'm trying to predict whether a cancer patient needs to see a psychiatrist, worried is probably not a good word, right? If a cancer doctor writes, oh, the patient's very worried, that's not good. But if I just remember that 2 words ago I came across the word hasn't, then probably the worried is actually no big deal, nothing to worry about. So that's kind of how those work. And then the biggest innovation is, as of the last 10 years or so, is called the transformer-based models. And that includes essentially all of the large language models that you might have came across. So an example of that is GPT. GPT is a type of large language model, and it's the brain that's inside ChatGPT when you go to it and have a conversation. And essentially, how those work is the AI is really able to understand how every word in a document, so the question you give it or whatever else, is connected to every other word in the document. So that really allows it to understand things like negation, or if I just said, hey, I'm going to tell you a story, please edit the story for me, and then you type in a story, it'll remember, okay, we're supposed to edit this story that was just provided because it knows how all the words connect with all the other words. So that's kind of that's the basis of the transformer models, also called LLMs. Okay. And then yeah, I think NLP is very interesting, right? Because we have a lot of these clinical documents everywhere, and a lot of those clinical documents have a lot of really interesting information. And so that's why it's been one of the focuses of my work. But also people really like to interact with natural language, right? I think what we've really discovered by how popular ChatGPT is that folks would rather be like, ChatGPT, what's a good recipe for this, as opposed to like Google and like scroll and find. It's really nice to interact with machines in natural language. So that's kind of one of the reasons why I think a lot of our research is really trying to move more into the NLP realm. Okay. Okay. So that was kind of the technical stuff. I'm now going to talk about some of my projects. Then we're going to talk about the kind of big picture. And then we're going to end with another project, and we'll give some time to look at that. So again, one of the examples of AI that we recently published, well, I think it's been 2 years ago now, is this idea of using it to help cancer patients, the mental health of cancer patients. So the problem is that when folks see a cancer doctor, there's a lot you're doing, right? You got to go through the diagnosis, you got to go through treatment, but it's hard for the cancer doctor to really have time to sit down and be like, how's your mental health? You seem anxious. I mean, almost everybody seems anxious, but how do I tell if this person should actually be referred to see a counselor or referred to see a psychiatrist? And the problem with that is that then a lot of people slip through the cracks. They don't get referred to come see us until it's really, really too late, or really down the road, when their depression is so bad that, for example, they phone their cancer doctor and they say, you know what, I just feel hopeless. I don't think any of this is going to work out. I don't care. I don't want to continue my chemotherapy. And then the cancer doctor, oh no, my patient's really depressed. I better send them to the psychiatrist. So that's kind of what the idea of this project, that we could predict it ahead of time, that we could offer those resources when people's mental health concerns are perhaps only mild, and maybe all you need is a counselor to see initially, and then we could prevent the bad depression. Or maybe you need to start an antidepressant, and then we could prevent having this horrible depression later on. So that's kind of the idea of the project, and it works by reading that initial oncology consultation document, and then the AI reads it and then predicts whether this person should see a psychiatrist or not. So to do that, we use the database of over 50,000 patients. Again, you need to provide the AI a lot of examples to say, okay, this is an example of the document, the patient saw a psychiatrist, this is an example of when they did it. You need to do that over and over again in order for the AI to really understand that. And then we tried a couple different AI models there too. Okay. And then, yeah, I won't go nitty gritty through the numbers, but it actually worked very well. According to some of the studies, it worked like old studies, it worked better than oncologists do in terms of predicting which patients actually have significant mental health needs. Accuracy is well above 70%. AUC, if you know that, is kind of 80%. And I'd say it's kind of a B student. So this was actually quite good performance. And there's, of course, many ways for us to keep improving it. So we're also looking into that. And I think one of the other the very interesting parts too was this technique we also developed to understand what the AI is using to make its predictions. So that's what this table shows. It's a little complex. So I'll walk through a bit busy. Sorry about that. And what this shows is the types of sentences that the AI thought were correlated or were predictive of seeing a psychiatrist. So, for example, breast cancer is a cancer that we know is very common for people to develop mental health problems. It has to do with a lot of things. Like breast cancer, usually happens a bit younger when people, are have young kids or so on and so forth. And it also has a lot to do with identity and how it affects the body and also the hormones. So there's a lot of reasons. But anyways, breast cancer is something that has more mental health concerns. So you can see that. Oops. So you can see that was one of the types of sentences that the AI realized. Oh, if a patient has breast cancer, increase their probability a little bit. Similarly, if they were doing radiation and chemotherapy at the same time, that was something that predicted needing to see a psychiatrist, probably because it's really hard. Lung cancer, we know that people with lung cancer often have more psychiatric needs. If you had a family history of breast cancer, that was also predictive. That's probably because if your mother or your grandmother, when you're young, they're going through breast cancer journey, it might be really scary. You might remember how hard it was for them. And then when you get diagnosed yourself, you might think, oh, I remember what that was like for my mom. I'm really worried about this. So that was quite an interesting one. And okay, one more before I actually keep going. But it was peripheral edema, which means swelling, and that can happen when you get steroids. And steroids can also cause mental health issues, and are often actually used for brain cancer. So this is kind of an interesting example of instead of looking for steroid use or brain cancer, it actually just looked for, well, if you have that swelling or not, there's actually a good chance that you're taking it because of steroids and taking that because you might have some tumors in the brain, right? So that's this kind of shows you what the AI is kind of thinking underneath when it makes its predictions. Anyways, so yeah, so that this project kind of using the AI to read those cancer documents and to predict AI mental health needs. And I think this is kind of one good example of these tools that we can actually use to really do things like predicting where mental health, if a patient's going to develop mental health care, so that we could potentially, help patients before things get bad. Okay. So yeah, I think we're gonna save questions to the end. I don't know if anybody's asked any. Oh, I see some in the chat. Okay, but I can't I can't look at this. So I'm really excited to look at them, and we'll do so at the end. I'll make sure we have some time for questions. Okay, so the next kind of question for crowd is, did you use AI at work or for clinically or whatever else before ChatGPT came out? So ChatGPT has been out for 2 or 3 years or 3 and a bit years. So the question is, have you used AI before that? So yeah, you're welcome to put up a thing or just talk to yourself or whatever. But I asked this question because I would argue that AI has actually been with us for a very long time. And I like to emphasize this because I think right now it can feel really scary that, oh, all of a sudden everybody's like deploying these new technologies and talking about how society is going to change so much. But I would argue that while things are changing, of course, we've actually had AI, been using AI safely for a very long time. So the probably most common example is ECG interpretation. Uh, you could argue whether exactly it fits all definitions of AI, but I would argue it at least fits some of them. We've been using that in hospitals since the 1980s. You've probably had an ECG at some point, and if you did, The machine will actually analyze the ECG first, and then usually a doctor will look at it after to make sure it's correct. But that's actually being used in healthcare for a very long time. Similarly, if you were a clinician in most of our health authorities around British Columbia, you might have been exposed to something called Fessor, which are these silly microphones that you talk into, and then it makes your document for you. So instead of having to type, "Oh, I saw the patient today; they were doing well," blah blah blah, you can just talk into the microphone. That we've had that for at least 10 years, and that is definitely a type of AI. Just an older version that didn't work as well, so I always had a lot of trouble using Fessor. But yeah, it has been again. It has been part of our clinical care for a long time. Another example is the stuff in your email. Your email uses a bunch of AI. It uses it for spam detection. That's all artificial intelligence. Spelling corrections arguably aren't artificial intelligence because you just kind of look at if the word's similar to where you want to write. But grammar suggestions, I would probably argue, are AI. Again, it gets a bit technical about how exactly you define it, but we've been using these things for decades. So the way I really like to think about it is the idea of point versus systemic change. And how this kind of works is when technologies are first developed, they tend to be adopted for, the Silicon Valley bros like to call it killer use cases. But, first the technology is deployed for very specific things that work extremely well. And then as society gets more familiar with it, as the technology develops, it becomes more everyday or more systemic. Okay. And so an example of this is electricity. So electricity was actually developed like in 1800 or well, I mean obviously we've had electricity, it's always existed, but in terms of like in little laboratories and stuff, they had it in like the early 1800s. They were trying to do things and inventing light bulbs and everything else. But initially, for many decades, it was just something that kind of British aristocrats and stuff would play around with in their home labs, right? Nobody really knew what to do with it or how to use it. But by the 1880s, they did start to actually use electricity. A little bit earlier in some places, but by 1880s, cities started to use electricity to replace whale oil. I can't imagine what a street lamp with whale oil would be like, but that sounds kind of stinky and smoky and a pain to fill it up, and you have to kill the poor whales. So I'm very glad that at that point they realized, huh, we have a use case finally for electricity. Let's string up all of our streetlights. And that was one of the first use cases. But again, you could have went to one of these cities with the streetlights that were electric. If you went into somebody's home, there wouldn't have been any light bulbs, there wouldn't have been any electricity. So this is kind of where we used to be, right? Where we had AI for our ECG, for our Fessor, whatever, but it was just a couple point changes. Okay. And then 30 years later, as more and more cities developed electrical grids to feed the streetlights and a couple other applications, it became more widespread. And then we started to see systemic changes where people started to adopt electricity for everything. So light bulbs in your house, and then this is an example of a toaster and of an electric vacuum from the 1910s, which I thought was kind of cool. They had vacuums back then. And by this point, you started to see that it was really being widespread. And so I think that's kind of what we're actually looking at for artificial intelligence. We've been using it for a couple point cases, but now we're actually using it more for systemic things, and it's starting to become adopted into a lot of parts of our lives. The other way to kind of think about it is the autonomous driving levels comparison. So they have this kind of interesting different levels for how much your car can autonomously drive. At 1, you just have little features like it'll brake for you or alert if somebody's in your blind spot. At 5, it's fully autonomous, and at the gradations, you have different levels of autonomy. And I think it's a good way to think about a lot of applications for artificial intelligence. There's a lot of things that might help doctors right now a little bit, for example, driver assistance or partial automation, but not actually replacing people. And a common question I hear is, well, are jobs going to be replaced, etc. And maybe some will. But the question I like to retort that with is, have airline pilots been replaced? Because planes have been driven by AI or other computational techniques, for decades. But when I go on a plane, I'm going to be hoping that there's still a pilot there. And I really think that a lot of use cases of AI are really going to be like that, where AI might be helping, they might be making the job easier, more effective, allow the pilot to take a little nap or whatever they do when the plane's on autopilot. I don't know. There's probably still somebody in the cockpit, I would assume. But they could. It's a bit easier than having to have your hands on the yoke the whole time throughout the flight. Okay, I'm gonna just skip this. We'll go to this slide. So now I want to talk about the kind of three different broad categories of artificial intelligence, just to give you an idea about what can AI actually do, right? Because I think there's a lot of like, oh, AI will do this, they'll do okay. So the first type is something called extractive AI. And I think this is a really cool use case that we're starting to deploy, and it's relatively simple, right? The idea is that you can have something like a big document or a big pile of data, and you can use the AI to extract useful information from it. So for an example, I know of a project elsewhere in BC where they're wanting to look at the notes that psychiatrists write about their patients and pulling out mentions of whether a patient has something like an alcohol use disorder. And this could be very well useful because then you can know, oh, actually a really high proportion of our patients suffer from alcohol use disorder. Maybe we should hire a alcohol use counselor for our hospital ward so that we could help all these patients with it, right? So that's the example of extracting, using AI to extract information, and it's a bit more complicated than just like Control F, right? Because you want something like if the patient does not consume alcohol. Well, okay, it says the word alcohol but does not consume. So you have to have it a little bit fancier than simply looking for certain words. Another use case, of course, is predictive AI, and I was just talking about that example. So, for example, the cancer case. But there's lots of examples of this. And really, you can predict anything you want as long as you have data that might be related to that prediction, and as long as you know the thing you want to predict, right? For at least some people, so you could train the computer. So an example of this is some of the work that's been out there to predict whether somebody will get better with an antidepressant. That can use lots of different data like imaging, lab results, clinical data, genetics, so on. Okay. So I was looking at this stuff. Some stuff that might be more relevant to you all. I mean, I know mental health is also very relevant too, but I was looking kind of for some more like a worker injury or that sort of thing, and they're actually having a couple studies, so you could look at those papers if you're interested. Coming out pretty recently, right? It's cool to see this field really growing. So for example, there was one project that was predicting whether certain postures would lead to injuries in workers, and that was using different, I think, sensors around the body. And then they're also looking at one at burnout, injury, and safety inspectors, which I thought was kind of interesting. So they would look at like what sort of places the inspectors are going to and that sort of thing, and then see if that would lead to industry. So injuries. So, anyways, yeah, I don't know if that's exactly relevant, but you can just see that you could really use these AI tools to predict a wide range of things. Okay, and then the kind of third broad category that I would also talk about is what's called generative AI. So that's the idea of creating new data from input data. So instead of just predicting, yes, no, will this person need to see a psychiatrist, or yes, no, will this person get injured? The idea is generate something new, like what's a good recipe for chocolate chip cookies, and then the AI will tell you something probably ridiculous, like who knows, but you can do that, okay? And so one of the examples of that we're just about to talk about in a little bit is a guideline chatbot. So we have these guidelines, clinical practice guidelines that will tell people, clinicians, how to do certain things. So for example, we have one how to treat depression. So if a patient fails this antidepressant, then you should try the next one, you should try the next one. And these guidelines are great, but people don't like to use them because they're like 50 pages long and you got to search and your patient's in front of you and you're like scrolling through a PDF and that's really annoying. Being there, done that. So we've actually made a chatbot that can help with that, and we'll show that in a little bit. But another example that's becoming very popular is the AI scribes. So the AI that listens to the conversation between the clinician and the patient, and then generates the clinical document for you, which is really nice because we spend so much time writing documents. It's just ridiculous. So this will give us more time to see patients, and that's a good example of a generative AI, and I think that's going to be coming out pretty soon. So yeah, and then kind of before I talk about the last little project, I'll just also talk about the term agentic AI. You might have heard that. Computer scientists kind of laugh a little bit sometimes about the term agentic. it's a bit of a wishy-washy. What does agentic actually mean? Because arguably, like any artificial intelligence is as an agent, that just kind of means it has its own autonomy. But one of the ways that I like to kind of think about more the agentic idea is that it's generally a more complicated type of artificial intelligence and one that could interact with multiple things. So I think in the future we'll probably have something like instead of you having like your calendar, you're going to have an agent that controls your calendar, and it will read emails that come to you requesting meeting times, and it'll respond for you and help you book things, and so on and so forth, right? So if that AI could make predictions, like yes, it's good to put you in this meeting at this time or that time, but can also interact with other systems, then I would probably start calling that like an agentic system. So I think we're going to be moving towards something like that in the near future, and I think it could be really cool. The hard part is really just getting computers systems to work with other computer systems. It's not really a technical difficulty; it's more like a socio-political difficulty that you got to get companies to cooperate and that sort of thing, which often makes it hard. So yeah, in summary, AI has been already used for point tasks within healthcare and mental health. And I believe it's going to become more systemically adopted for many other different tasks. And we talked about the kind of extractive, predictive, and generative types of artificial intelligence, and I gave a couple of examples of how that might work. But I would also like to say a human in the loop will likely be required for quite some time, which human in the loop is the kind of computer science term to mean that the AI is helping do things, but you still have to have a computer kind of there and observing and watching. Okay. Okay, so we're doing good for time. Last couple minutes, I just wanted to end with one last kind of cool project that we're making some good progress on. So as I was talking about, we have those clinical practice guidelines, and the question is, can we use them to help clinicians use use them? Okay, and the first question people kind of ask me is like, well, John Jose, why don't you just use ChatGPT? If you don't know what to do with the patient, just go there and be like, oh, I don't know, I tried this antidepressant, ChatGPT, what should I try next? And you can do that. Some of the results aren't too bad, but they are prone to hallucinate or to answer incorrectly, right? And when you're doing something as a clinician, it's usually important that you're not okay if there's 20% chance of doing the wrong thing. You're not okay if there's a 10% chance of doing the wrong thing. You really need to be quite assured that what you're going to do is correct. So when we use the general chatbots, that is kind of a big problem. And there's also a lot of privacy concerns, right? If you use ChatGPT, you give it patient information, that is very bad. It will go to America, it'll go to some OpenAI, the company. You don't want to do that. So we built a project instead that only uses the specific guideline to answer questions. It doesn't use all the weird things that the LLM might know or might hallucinate. It really focuses on the use of this one guideline. And there's also some technical stuff that allows it to be deployed locally, which means that a hospital could run it itself, or you don't need to trust some other big American company to run it. You could run it yourself, right? So that's kind of the reason that we're doing it. We're to do this, we're using something called retrieval augmented generation. And this is an exciting area of AI and NLP right now. And again, what the idea of it is to train chatbots to only use specific pieces of information, which allows them to be a bit more specific and a bit more expert. The analogy I like to use is, if you want to talk to a doctor, you talk to somebody who's specialized in something, or even a GP has like a lot of very specific training on how to be a family doctor, right? You can't go to a layperson, this person off the street, and be like, hey, what should I change my antibiotic dose? That's not going to work. And it's kind of the same, I think, the same thing for chatbots. ChatGPT is good for like general questions and it knows a lot of stuff. But if you want a more specialized answer, you kind of got to go to a specialist. And so that's why I think chatbots like this will be helpful. Okay, so yeah, we do have how to get RAG to work is a little bit complex. You have different steps and different ways to like cut down the document and kind of process it and so on and so forth. But yeah, I'd like to give the opportunity for folks to actually try it out. So actually, maybe what we can do, what I'm going to do is I'm going to put that URL in the chat. Let's see here. Yeah, because it actually won't work on mobile, I don't think. Some of my students are trying to make it work on mobile, but if you use the QR code on your cell phone, it probably won't work. Yeah, you're very welcome to try it out and actually see how it goes. And if anybody has a question, though, I could please put it in the chat for me to ask the chatbot, just to show you that it's working. I'd be happy to show that. I'll just pull it up myself here. Can you send like, oh, I just tried to put it there. Here, I'll pop it in there again. Okay, so yeah, if you click on that link, it should work. But yeah, if anybody has a question for me to ask the chatbot, just to show everybody, I could ask my own question, but then you're gonna think I just, gave it my own thing. So here, let me just show you. Oh, I'm sorry. Okay. All right. I apologize, everyone. It was only going to hosts and panelists before, but now it should be going to everybody. There we go. Got it. Okay. So that should let you use it. So I'll just show you it in progress, just in case you're not able to get it to work yourself. So here's our chatbot interface. So we could click new chat here, and then you can do something like my patient with bipolar 1 disorder is very depressed. What medication and is on lithium, but it's not working. What should I try? Should I try next? Okay. Now it does take a little bit, and I'll kind of walk through what this is doing right now. There we go. So here's the answer on the left-hand side, and I'll explain what the right-hand side is. So what it says is you're based on the guideline, your patient's already on lithium, which is a first-line agent, so that's good. But you might want to consider using an adjunctive treatment. So that's when we combine a medication with something else. So for example, you could add something like lurasidone or add lamotrigine. Okay. And then it tells you to consider stuff. And then down here, what it's actually doing is telling you what part of the guidelines that it's based on. And on the right-hand side, we're going to be changing this soon, but this again, this is in development, so you'll have to forgive me if it's not 100%. But what this is showing you is chunks of those clinical practice guidelines that are most relevant and that are being used for this answer. So you could see that there's a paragraph on adjunctive use of antidepressant therapy. You could see that there's one on some figures, so on and so forth. And Zoom won't work, but if you were to click on source, it'll actually pull up the exact part of the document to look at, unless, yeah, as long as it's working, which I think it is. So yeah, we're really excited about this. I think this is a good example of how AI can really be used to help clinicians, not to replace us or anything like that, but to just help us use evidence, what actually is the best medication for this patient, to use AI to really enhance that and to help folks. So with that, oh yes, yeah. So if it says warming up, it will take like a minute or two to warm up. I am sorry about that. If you're trying it on your phone, I don't know if it'll work. You might have to use the desktop version. I am sorry about that. Yeah, we only realized that it wasn't working on mobile a couple of days ago, and I have a great team of students working on this, but sometimes they're not able to push things super quickly. But yeah, I'll just I think we're pretty much at the exact moment. So I'm very happy to answer questions. Oh, and I already saw folks saying this is an incredible tool. So I really do appreciate that. Okay, so now that I've showed my what I think is a funny slide, very happy to answer questions.
Yeah, so if you have any questions for John, feel free to put them in the chat. I see earlier in the seminar someone asked, can private companies or individuals get access to the data set? Like, I assume they're talking about ChatGPT to do their own analysis or build useful models. And if yes, how can we get access to the data? I don't know if that's anything you could answer yourself.
Sure. Yeah, so I don't know which data set you're referring to in terms of the health data. So as you would imagine, patient data is very, 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 very protected, right? To give you context, it took me about 2 years to get the data for the cancer, the one. the cancer project, because we needed to make sure that we could use it safely. So the data never left the BC Cancer Research Center servers, and we had to have privacy things in place and encryption and lots of different things. So a private company probably can't. Probably they would need to be helping with like a research project or another thing, and they would need to get a lot of approval processes. So it is a big thing. It's interesting, right? Because it's this balance of patient privacy and ensuring safety, which is extremely paramount, but also allowing folks to innovate and make tools that could help people. So it is an important balance, but it's one that is really important. And I help a little bit with this at PHSA, and it is yeah, it's something we just think a lot about, right? So yeah. Now in the States, in the United States, you actually can, if you're a private company, just go buy data. It's a little bit frightening to be totally honest. Sometimes you could. I've heard of folks going to like a healthcare sector and just paying a certain amount of money and then they'll give you the data. I'm sure there are still processes to make sure it's safe, but it is a little bit different. So I am really glad that we have a very robust mechanisms here in Canada. What base model was used to create this Ray chatbot? How is the accuracy measured? If someone uses it, how can they be certain of the information provided? Yes, so those are absolutely fantastic questions. So it's just the base. There's a couple different base models because you have the embedding model as well as the LLM to handle the chat. The chat one, we've just been using like your Llama models, so Llama 3 at the different configurations. So these are open source models, which means that no company can audit it. It's not proprietary. Anybody can use it. So that's what we're using there. How are we judging the accuracy? So we're actually just about to do that. We're actually just about to do a quick user study. We're going to start by just asking some like experts in mood disorders to rate the responses of some of the questions. And there's a kind of a set of like 5 or 6 different parameters that we tend to do. So correctness, potential for danger, trustworthiness, usefulness, so on. So there's kind of different characteristics. Eventually, once I get some grants, the larger grants, we'll hopefully run a big pilot study that'll be blinded. So we'll ask people to use, we maybe even use ChatGPT for this situation or use our app, which works better, so on and so forth. So there's going to be a bunch of evaluations. Did you design the tool? It's awesome. Yeah, well, I have a great team of some students that are all working with me, but we are really excited about it. So really thank you. Great tool indeed. Thank you. Um, can you use this app for health all questions or just mental health? That's a good question too. So right now we're really focusing on just having really specific tools. So when you ask questions, it's only using information inside this one guideline document. So the app I showed you is for the guidelines for treating bipolar disorder. So any answer it gives is going to be related to bipolar disorder. That's all it's doing, right? And that allows us to be very specific and to help ensure that it's giving answers that are related to those guidelines. Eventually, it would be really great to build a bigger tool that can do mental health questions throughout all of mental health. So definitely something that I would like to eventually develop, but this is and it's nascency, so we're starting with that. Okay, checking down here. Is it possible to chat with this afterwards? Yes. Yeah, you're welcome. You're welcome to keep trying it out and play with it. Yeah, for sure. So you're welcome to. I mean, if you don't mind, my only request would be just don't like share it on like social media or like something that's like super public just because we're still building this and I want somebody to come like steal it and then write that they wrote it. So I'm happy for this to be included in the webinar and everything else, but just the actual link to the thing itself, if you don't mind, maybe just don't post it on like social media just yet. We'll hopefully have the paper out in a few months. Do you see AI performing surgeries of fully autonomous healthcare machines in the future? Uh, yeah, that's a great question. So right now, 3 dimensions is really hard for AI to figure out. It's good at looking at images, but the second you have to interact in the 3 dimensional world, it is a lot harder. Okay, there have been quite a few. There are right now like surgical machines that use AI that surgeons can kind of work with and utilize to help these surgeries. So I do think it's coming, but again, I tend to think it's going to be more human in the loop for right now. versus completely replacing a surgery, right? The point at which a computer comes in and does the entire surgery, there's no surgeon in the room. I think that is going to be probably decades away, right? And that's kind of how I feel a lot about a lot of different parts of healthcare. I think it's going to be important to have that human. The interesting thing too, I mean, it's a bit of a tangent, but one of the interesting things is that when they've done analysis, for example, of AI reading radiology reports, like an X-ray, right? The AI isn't perfect, and the humans aren't perfect. Both of them will make mistakes. That's of course, right? Everybody makes mistakes. But the types of mistakes both of them make are actually quite different. So the best thing is actually get them to work together. And I think that's going to be a really good way also of thinking about these AI tools, is that the human brain and the AI brains, they do have some similarities, but they still work very differently. So it's actually probably best to have both of them kind of working at the same time. Um, the radiologist looks at the X-ray or looks at the AI's interpretation of the X-ray, and then, that doesn't seem quite right. I'm looking at myself, right? In unison, it'll actually work better. So, yeah, in the next couple of decades, I think it's mostly going to be human in the loop. 30, 40 years from now, I think it's hard to say, right? For all of society, humans tend to there's an interesting saying that we tend to overestimate what's going to change in the short term and underestimate uh, underestimate what's going to change in the long term. So, and I think that kind of is applicable to AI, right? 30, 40 years from now, even 20 years from now, I think there's going to be a lot of big changes. But I'm not really in the camp of people who think that, some of the big AI guys have been like, yes, in the next 2 years, 50% of jobs are going to be replaced by AI. I think it's kind of laughable, personally. But we'll see. Maybe they're right. They probably know more than me. But we'll see. As an AI developer and researcher and stuff, I'm a little bit skeptical that we're going to move that quickly. But again, we'll see.